Right, we're on. Good afternoon, everyone. It's Dave Munday here, Lead Professional Officer with the United Union in the health sector. I'm not going to lead much of today's session. I just wanted to give a little bit of information about how you can interact with what we're doing today. If you want to ask any questions, next to the video on Facebook Live, you should be able to see a little timeline of comments. If you want to put a comment or a question, please put it in there. And as the session's going along today, I'm going to try and keep my eye on that on my computer. You can also tweet, so if you want to tweet, make sure that you include our Twitter handle, which is @unite_MHNA. I'll get a notification to say that you've sent us a message, and obviously then we can think about getting that question or the comment into the session. The other thing that you can do is send me in an old-fashioned thing, an email, dave.munday, MUNDAY, @uniteunion.org. And again, I'll get a notification that you've done that, and we can feed into the session today. But that's me kind of leading on today's session. I'm now going to pass over to the proper leader of today's session, and that's Nicky. So go for it, Nicky.
Hello everyone, and thank you very much for joining us today to talk about periods. I think you've made a very good decision. I think perhaps it's best off to introduce ourselves first, and then start to think about how we came to decide this was an important subject to discuss. So my name is Nicky Lambert. I'm on the editorial board for Mental Health Nursing, and I'm also a proud mental health nurse for 20 odd years, and I teach nursing as well at Middlesex.
Hi, I'm Liz Hughes. I'm a mental health nurse, also proud to have worked in the profession for over 20 years now, and I'm also a Professor of Mental Health Research at the University of Leeds and member of Mental Health Nurse Academics UK.
And I'm Dave Munday, Lead Professional Officer with the United Union in the health sector. I lead on mental health. I am not a mental health nurse, I'm a health visitor, and I'm sure you'll forgive me for that.
We do.
Alright, so perhaps it's a really good idea for us to start thinking about how this first came about as a topic.
Yeah, so there was a conversation on Twitter, and it must have been early summer last year, and it just came up about... certainly the thing that hit me was the service users who'd experienced an inpatient setting had also had issues around accessing sanitary products when they had a period, and they were quite harrowing stories, you know, really undignified, unpleasant, horrendous experiences. Where, you know, they didn't have anything, they had to use bath towels, staff weren't very sympathetic, or there wasn't anything that was actually that obvious for them to kind of use to help them through that particular period. And I just think on top of the, you know, being incarcerated in a hospital in a very distressing time, having this on top of that, and I suppose as a mental health nurse, it really got me kind of thinking about what we do about this, and how much time we spend kind of thinking, does somebody have access to the right products? And it's not just, I mean, the other issue is some people talked about being given those horrendous kind of what we call bricks, like a sanitary pad, that really unpleasant and very uncomfortable and just unpleasant, or through to nursing staff giving them something out of their own handbags. And I just thought, you know, surely there's something we need to do about this. So we kind of had some more discussions on Twitter, and we also then took it to Mental Health Nurse Academics UK. And after a kind of lot of discussion and some emailing and some various drafts, we kind of pulled together a kind of position paper, didn't we, around some of the key issues, both from a kind of nursing, thinking about nursing, but also, you know, trying to pull those experiences out that we had from Twitter and use them to kind of demonstrate, you know, this is a really important issue, but we're actually not addressing it very well.
It's a strange one, isn't it? Because I've been a manager of women's services, and I'm not sure I actually gave it that much distinct thought as separate to anything else. And I think one of the things we might also touch on later on is thinking about sort of women's bodies around things like menopause as well, and how we're approaching all those sorts of sort of physical embodiments of mental health. We talk a lot about physical and mental health together, but we don't necessarily think about the gender aspects of that as well.
Absolutely.
That's something to think about.
Yeah.
I did actually grab a couple of the tweets. So one of the things that really stood out to me was I got given pads in hospital, massive, horrible mattresses. A kind nurse went and raided her own stash to give me something normal. It meant so much, but it shouldn't have had to happen, really. And I think that's one of the things that really stood out to me, as I remember thinking we need to do something about this, was when you said, absolutely finances are tight, but you wouldn't have a ward without toilet paper.
Yeah.
So why do we allow this to happen?
Yeah.
What do you think that might be about?
I just think we've taken our eye off the ball, to be honest. And I think there's this expectation that people, when they come into hospital, they'll bring their toiletries, they'll bring things, they'll be prepared. But as we know, especially now, quite a lot of mental health admissions are not planned. They're usually emergency admissions in a crisis. At that point, people aren't going to think, oh, my period's next week, I better pack some stuff with me. Usually they kind of come in with nothing, not even a change of clothes. So alongside that, I think we can't expect people to have the planning, during a crisis, to think about everything that they need. I mean, it kind of goes across toiletries, soap, shower gel, all those things that kind of people are not going to have them, or a change of clothes. But also, the other issue for me is that your friends, family, carers may not actually be very local to where you get admitted. And so with the bed shortage as well, you're not necessarily going to have someone who can pop up with stuff a couple of hours later. People are often admitted miles, and adolescent units, we know young people are admitted hundreds of miles sometimes from their families, who could then bring stuff in. So I think we need to sort of have something in place. It should be a standard thing, like you say, you wouldn't have a toilet without toilet roll or paper towels to dry your hands. We just need to have these products are basic. They're not luxury. This is 50% of patients are women, 50%, and they'll all be having their periods within a 4-week cycle. So it's highly likely someone will have a period while they're in hospital, and so we just need to be prepared. I mean, one of the other things that came up for me was the indignity of having to ask for something as well, and not always being able to ask another female member of staff, and feeling uncomfortable about asking a male member of staff around sanitary products as well. So something about having them where they're accessible without actually having to knock on the ward office and go, please can I have, and how many do you get, and you're going to get one at a time, or are you going to get enough that you need? So that for me is really important.
Kind of like the physical access, isn't it, in this idea about sort of to moving on a little bit into terms around conversations as well. So one of the other Twitter comments was, I told my GP and my psychiatrist that my periods had almost disappeared on psychiatric medication. The GP told me to ask the psychiatrist because he'd know more about psychiatric meds. The psych just looked embarrassed and said, ask the GP. Neither of them seemed to think it was remotely important. And that, I think, really struck me as well. This idea that whose job is it?
Exactly.
Whose job is it to have this conversation?
Yeah. And do we ask? Because, I mean, we're really bad assessing side effects anyway. I mean, we know that. We're also extremely bad at asking about sexual side effects. And I think, the kind of menstruation impact is a part of those prolactin raised kind of side effects, which are often not even asked for. And they're things that you can do. They're very straightforward. You can lower the dose, you can try a different medication, you can look at other things to kind of alleviate it. And, not having a period's it can be quite useful for some people, but also it can mask, people might actually be pregnant and not know about it because their cycle could be coming and going, and they might be fertile and sometimes they're not. So those issues are really important. And so, the other side of the coin is if people have really bad periods, whether that's premenstrual disorder, a sort of emotional impact of it, through to, really heavy periods that could have fibroids. There's things that people can do to alleviate that. But if you don't ask and you don't have those conversations, then not only are you managing your mental health problems, you're also quietly just putting up with women's problems, that you don't actually need to. So, because it's never talked about, I think it's not addressed.
Part of the problem, isn't it? This idea of it being not a secret necessarily, but something that's so private.
Yeah.
So one of the other tweets was, I missed my only chance to see the psychiatrist as I floated, so had such a heavy flow that she had to go and get changed, whilst waiting to be called in. By the time I got back, the psych doc had left to teach me a lesson about punctuality. And that's really difficult, isn't it? Because I think this person, I'm assuming, felt that they couldn't even defend themselves by saying, actually, I wasn't very well. So there was something around the fact that if we don't have these conversations, people start to feel that they should be ashamed or they should be embarrassed. And we're nurses, what are we doing?
I know.
And I think that's one of the things that's really good about MHNA UK and Liz leading on this, that, you know, actually to have academics who have kind of like the future of mental health nursing in their hands, talking about this issue is really important, because, you know, me as a male nurse, as a health visitor, it could be really hard as a young bloke trying to kind of think about how to have these conversations. So you need to be able to explore that kind of difficulty in a safe environment like the classroom, to then sort of go on to, you know, to placement, and then to have these conversations with people. And hopefully this is kind of a way to make it a more sort of issue that people are comfortable to discuss. And ultimately, you know, it should be something that everyone is comfortable discussing, but obviously we know they're not. And how do we shift people into being into that space so they feel that, you know, the conversation is much more natural, and they don't feel embarrassed to do it. So I think, you know, it's great that MHNA UK and Liz has led on it, because I think that's the right place for it to come from, really. And hopefully, you know, people watching today will kind of start thinking, well, actually, how can I kind of adopt some of these thoughts? How can I kind of develop this locally? So no, it's a good start.
I don't remember as well, thinking back to the decades ago. I don't remember us actually sitting down and talking about kind of gendered health needs at all, really. Let alone, you know, you expected to have your own experience of your own body and a general biological understanding of other people's, but it wasn't really put into any kind of sort of human context. And so you might need to think about, and so you might need to do. But if you go back to our own NMC Code of Conduct Bible, so the first thing it says is to treat people as individuals and uphold their dignity. You must treat people with kindness, respect and compassion, and make sure that you deliver the fundamentals of care effectively. And for me, I really think we have, as usual, fantastic pockets of good practice. And if you are part of a pocket of good practice,
let us know.
Yeah. And if you have a particular sort of burning desire to do some work on this, or to think about maybe looking at getting together best practice guidance, or developing sort of like a teaching or a learning thing, please get in contact and let us know.
Yeah, and just on that point, after today's session, we'll update the post so you've got contact details, and also for those that have registered, we'll send out more reminders about how to get in touch with us, just so we can keep the conversation going on this subject.
Absolutely.
Yeah, because I think the other thing to think about as well is what trusts can do kind of across the board around this, and just really get it on the agenda, and think about the kinds of things that people need when they have their period, because it's not just about pads. They might need new, you know, change of underwear, you know, like the flooding, and bedtimes and night times are really bad. You know, that's when people can have, you know, flooding and things like that. So do people have access to kind of fresh sheets, fresh pyjamas? You know, can they get up in the night and shower? I did read something that was really kind of worrying as well, where in secure units women are not allowed to have access to their own sanitary products because of risk. But I wasn't really clear about and it seemed like a blanket, and then obviously there may well be specific incidents and specific circumstances where that is, but it seemed to be a blanket no, you can't have any products like that. And then you kind of look at that issue and think, well, hang on a minute, how is it actually managed then?
And I suppose that's another place where it'd be great to get feedback from out there, in terms of if there are examples of, you know, blanket policies that are saying no because of risk, then, you know, what is that? Because if there is, then we need to share that and get that information out there as well. So yeah, really important.
So one of the things that did happen, start framing, was this idea as well that we needed to sort of get sort of position statement together. So that will be available as a document afterwards.
Yep, so Ben, the new chair of MHNA UK, is busy now, putting it all onto their website, and we will supply a link to that. But if you just Google MHNA UK, you'll also go straight to their website. So yep, it's available.
Yeah, it basically covers a rundown of what you can expect with periods or menstruation, how you want to describe it, who you might need to consider, because one of the things to bear in mind is that it's not just necessarily women who are born as women and stay as women who have this issue. Some trans men have this experience, and sometimes women who have actually technically gone through the menopause may still have vaginal bleeding that you need to be really aware of, particularly as it could be a sign that there's other physical health problems.
Absolutely,
so just knowing, you know, what to expect, what's normal, how long periods last. If that's something that you're not familiar with, through no fault of your own, I think it's really important that when you realise you've got a deficit in your knowledge, that you just address it. It might be something you did in school years ago and then never came back to.
Exactly.
So we have that information here. We also have some suggestions that have been gathered together from Mental Health Nursing UK and other people of whom have clinical practice as well, thinking about things that we might look at moving forward with. So I'll suggest, I'll just run through them today. So this idea about having a welcome pack, so exactly as you were saying, you don't have to beg, borrow and steal. And this idea about workshops and routine asking. What were your thoughts about this idea about what we might need to provide in terms of workshops or in terms of asking people to ask about?
Well, we've got an ideal situation in many ways with the agenda for single-sex wards. We have got a ward environment, or certainly, a part of a ward that will be single-sex, which will be just women. And there's your opportunity to kind of have a women's group around all these aspects, get the women together and kind of find out what their experiences are, what their needs are, what the staff can do and help them with. And if there's issues raised, so for example, someone might not be having periods because of their meds and they're worried about that, then there's obvious steps, but if you don't know, to find out what those might be, rather than just leave people to kind of suffer particular issues as well. So I think those workshops are good, but also kind of getting the staff thinking about, men and women's physiologies are not the same. They respond to meds the same. A lot of trials tend to be done with men only because the risks of anyone becoming pregnant during a drug trial is too high. So a lot of the meds are tested on men only, but are given to both genders. So you've got all sorts of issues around that as well, and we just don't, like you said before, we just don't think in a gendered way about any of these issues.
And I think it comes back to the point you mentioned earlier, Nicky, that as nurses it should be something that we feel comfortable in discussing. That if you think about the huge range of communication that nurses have to kind of get involved in, so from quite mundane to exceptionally kind of sensitive and complicated. Then actually this kind of should be somewhere amongst there. And to put it bluntly, it is important that people feel confident to do it. So how do we improve that confidence? And normally it's better to do that in an environment where if you say it wrong the first time, it doesn't matter. And someone can say to you, well, actually, that was a bit of a stupid thing to say then, and don't say it like that in the future. I think thinking about my own experience as a health visitor, obviously, having to discuss things like periods, having to discuss things like breastfeeding, and also to the more kind of, really complicated stuff. So, for example, around domestic violence and domestic abuse. It's that kind of bit about, when I was in training, I would learn that from having a really good practice educator who would kind of talk to me about the issues and think about how I would have those conversations with people that I was caring for. We would then sort of role play those sort of times to sort of practice, and it's that kind of bit about, for people who have really good placements, that will just happen and it will be successful. So do we need to think about places where that doesn't happen, and so the academic fraternity kind of think about how do we bring some of those lessons in the classroom first. And I think that then has a positive effect as well, because we know that there are students out there that are amazing, that once they're given that confidence in a classroom environment, will then go out and influence the people that are already registered back in. So again, it's that kind of bit about there's lots of good opportunities through this to make it a subject that people discuss much more openly and often.
There's lots of toolkits and things like that available as well, which we'll talk about. But I think another thing to remember is we're not without skill. Everybody who works in mental health knows how to ask about taboo or anxiety-raising subjects. We talk about life and death issues all the time. We talk about risk all the time. And I think it's interesting that this is still to the side when we have such personal comments and conversations with people. So one of the things you can think about is there are things easy and free to download. So Rep Toolkit, that is from Unite. Do you want to talk about that?
Yeah, so I'm sorry to say we were going to be joined by Suzanne today, who is one of our officers in the North East Yorkshire and the Humber region, and she has led on a brilliant campaign around period dignity. This isn't specific to mental health services or settings, it's actually more kind of out there in the world. where it's about saying that there should be period dignity for everyone. And that's not just Unite doing this work, other trade unions, other organisations have been being much more vocal about this issue over the last year or so. Unite has done a lot of work in terms of encouraging our reps who work at employers to think about how to make their employer a place of period dignity. So just as an example, if you go into a Unite office across the country now, you should be able to go into the toilets and find sanitary pads, a full range of stuff available to take. What we found, and again it's really good to get feedback on this, because I was talking to a few of our staff members in one of our offices, and they were telling me how actually in one office, instead of just putting them in the toilets available to take, you had to go to reception and get them off the receptionist, like it's this kind of, special permission given to have a period.
Yeah.
It's like back at school,
and how many are you going to have?
Yeah.
And again, it's that kind of bit about that's not the point of this. It's much more about it becoming a much more kind of natural.
It's a human experience, isn't it?
And like you said, the example of toilet roll, you would never imagine that you would go to the toilet and have to go out to the reception and ask permission to get a toilet roll. Even though I have had a few examples in service station, petrol station, where it kind of feels.
Well, let's aim for slightly better care.
Yes, we definitely want to do that.
Yeah.
And so there is information on the interweb about this from Unite. There's 5 key aims that they've talked about: changing attitudes towards periods, employers to provide sanitary products in the workplace, places of education to provide sanitary products for students and employees. And that's a really important one, because we've heard how young girls' education is being undermined because of them having a period. And again, how backwards is that in today's society? Ensuring that VAT is removed from all sanitary products, and supporting the period poverty campaign groups. Something else I want to say is Paula Sheriff, who is Labour's shadow Minister for Mental Health, has done lots of work around period dignity. And again, I'm hoping that we'll be able to have conversations with her about this new document from MHNA UK, because I think it dovetails 2 things that she's really passionate about, and hopefully we can get this much more on the government's agenda. One of the things that I wanted to ask you, Nicky, was I know the Women's Task Force for Mental Health. They worked last year and their report came out late in December, and I know you were involved in some of that work, so I don't know if there's anything you can feed back from that.
Yeah, I think what I would say is, if you haven't had a chance to read it yet, it's been widely tweeted, but please Google it, have a look. It's the Women's Mental Health Task Force. It came back, I think, December 18th, something like that, and it, for the first time, maybe 10 years or so, has actually putting back this idea that our health, mental and physical, takes place in our bodies, takes place in our communities and our societies, and those things are all mixed up together. So how we think about ourselves, our well-being, what we're entitled to, how we think about our dignity, our respect, our bodies, what's normal, what's natural, and how we support each other, that is absolutely key to well-being. And I think it's something that's not just about mental health, it's about treating each other kindly and with respect, and also having a real understanding of the importance and fundamental importance of dignity. We shouldn't be shuffling around the place embarrassed about being human beings. I think it worries me that we still have these hang-ups around things which just are so normal and average and everyday. And I feel very concerned at times when I think of half the population being sidelined because of it, or being put on the back foot because of it, because it's so unnecessary and it's so predictable. So I think for me, what I would say is please read the Women's Mental Health Task Force. It's actually quite an exciting time to think about. I would say periods generally, it's always an exciting time to do that. But thinking about women's well-being, thinking about the RCN are doing work on women's mental health and menopause, and they have a great menopause lead there. If you are in that situation or in that time of life, or working with and for people who are experiencing natural human aging, who are women, please make sure that you're able to have conversations about periods, about period stopping, about menopause, about symptoms of just physical aging for women.
And also your options, and you don't have to do, don't have to, it's not something to be tolerated. There are natural things that you can do. There's medications, there's lifestyle changes that will all just make some of those symptoms a little bit more manageable. So people don't always know, and they find out too late. Oh, if I'd have done that, I might have not had those night sweats, or you know. So I think it's really important, and it kind of goes back to the issue around periods and the kind of one thing that I'm, you know, staggered about is thinking about premenstrual dysphoric disorder, which is now an actual diagnosis in the DSM-5, which is the diagnostic kind of manual. And it used to be something that women were just completely fobbed off about. It's like, oh, well, you know, it's just, you just got mood swings. It's really severe. For some women, it's so significant. It's the thing that will exacerbate maybe an already problematic mental health problem, or it could be something that women have a very profound 2 or 3 days a month where life is really quite unbearable, and have never really been taken seriously because it's just saying, oh, it's PMT, and just put down to that, or any cyclical changes is put down to their mental health problems rather than hormonal fluctuations. And again, there's plenty of things you can do now. It's recognised, it's a medical issue. And people need to not be quiet about that if they're noticing these kind of, you know, ebbs and flows. You know, there are things people can do.
So we're getting towards the end of our time now. So if we think about what we've gone through, we talked about how we came to raise this as an issue. And I say, please have a look at the PDF that will be attached. Just and if you want to add to it, if you have comments on it, things you disagree with, things that we've missed, for goodness sake, please.
And we probably will have missed stuff, but you know, we tried to do it. This is the point we've got to with the position paper. It isn't necessarily a be-all and end-all piece of work as well. Absolutely. So it's certainly something we want to carry on talking about, really.
And I think one of the things, like I say, is I'm keen to have kind of real sort of outcomes in terms of saying this is what mental health settings should aspire to, and the kind of working with politicians to think about how they can influence, say, DH and you know other bodies to kind of push that message that it shouldn't be up to individuals just having to raise complaints locally. It should be that, you know, there is a kind of a weight behind improvements sort of going forward. I think the other thing, just in terms of the work that Unite's doing, obviously it's things like, you know, if it's an issue you can contact your own MPs about, if you can raise it in your workplace, saying, you know, not just in terms of members of the public that are accessing services, but for staff as well, that they have access to sanitary wear in the toilets.
And also feel free to do this if you're a guy. This is not a women's issue; it's a people's issue. And I think, you know, we as nurses, we have a mandate to speak up about dignity, compassionate care, and things like that for sure. But I think as a human being, you know, we're not going to get anywhere unless we stand together and say, actually, this is a good standard of workplace dignity. Let's do that.
And again, you know, it's an issue that I am passionate about. Not that it'll ever affect me, but that I just expect that anyone going into a health service should be able to expect that it's of a reasonable standard that actually provides dignity to them as an individual. So, you know, my solidarity to anyone that's going through the situations that were described in the tweets that led to the paper that Liz has led on.
And I think the other thing, if you are a male nurse, chances are that no one's ever really spoken to you. As a patient, probably won't speak to you about these things because of your gender, because they possibly perceive you might not want to hear it, or you might not be interested. So, you know, in some ways, it might be worth asking and just getting more informed about it yourself, be more approachable as a male, you know, and that might be another thing to think about, because it might be, no one ever says anything, but they might because of that barrier.
I always remember my first experience as a student male nurse going into a handover at Stepping Hill Hospital up in Stockport, and it was a room full of women and me, and I, you know, very new, as I say, first placement, and one of the other nurses come in who just returned to maternity leave and said, right, you're all on breast watch, you've got to check that my breasts aren't leaking. And it was such a kind of a steep learning curve from kind of being a very kind of, you know, not expecting that to them being sort of exposed to it. But again, you know, that's what makes us strong as professionals, isn't it, about having those conversations. And like I said earlier about trying to find the safe spaces at first to do it, so you feel really comfortable doing it. And it's our duty, as like you say, under the NMC code. It doesn't say
the code of being a decent person.
Yes.
Yeah.
This is the code for men and this is the code for women. You know, we all should be decent about it.
Yeah, absolutely. So what we would love is if you would read the paper and think about it. If you're not in health services, think about maybe working through a trade union or any other organisation to look at workplace dignity, just generally speaking. The other thing is there's period dignity as a movement. So I think I want to say the 28th of May, don't quote me on that, check, is a celebration day looking at this amazing, wonderful thing. It doesn't feel amazing and wonderful necessarily when you're having one, but I think when you look at it from a biological point of view, it's an amazing gift to have, you know, the ability to have this physicality. So I would say absolutely, if this is of interest to you, get involved, look at celebration days, look at all the resources because there's tons of stuff around it. If you're working in schools, make sure that young boys and young women understand what's happening to their bodies and it's not a shock and a kind of fear, a thing of fear for them. The other thing I was going to say is maybe Mental Health Nursing Academics UK, we can have a think about how we look at this in our curriculums as well. I think that's going to be something.
Well, we're moving so much more to kind of looking at kind of integration of physical and mental health, and we really do need to think about this not just in mental health but also in acute hospitals as well, or you know, in the community. So I think it's across all fields really.
But mental health nurses are leading.
Yes.
Absolutely. That's a lovely place to start.
Yeah.
I just wanted to finish with saying thank you for joining us today. Thank you to our excellent panel members, including myself. We're trying to do one session a month with MHNA. I'm getting all confused with all the different letters now. Mental Health Nurses Association, a part of Unite. If you're not a member, please do join. But we're hoping to do a session like this every month, and we're not going to do it on kind of just a set group of subjects. So far, the range has been what I would probably describe as immense. Last month we did a session on Brexit, and this month we've done a session on periods.
I think we did the
I don't think we can get more diverse than that, to be honest.
So if you've got ideas for sessions that you would like MHNA to cover, then please let us know and we will look at how we organise that. We're really lucky because we've got amazing members that have knowledge about lots of different subjects that we can call on. So just get in touch and keep your eyes on our Twitter and Facebook feeds because we will let you know about future sessions through there. So thank you, Nicky, thank you, Liz, thank you for joining us, and we're going to finish it there. Great.
Okay.